Hey, it's Dr. Day. Today we're going to talk about some options for medications while you're pregnant. I know a lot of women have questions about what's safe to take in pregnancy and what is unsafe. And so today I'm going to give a kind of a brief overview of some medicines that would be safe to take in pregnancy. Most medications are labeled, and there is a classification system for medications in pregnancy. Most medications that are A or B category are very, very safe in pregnancy. Medications labeled C or X would be medicines that we would really want you to consult with us before either continuing off previous medication with those labels or being started on those medications, because they can have some teratogenic effects to the fetus. And even if not teratogenic, can affect the fetus because they pass through the placenta. But there are some medicines that are certainly safe to take in pregnancy, and we're going to go over some of those today. Many women in pregnancy have issues with nausea in the first trimester, and there are certainly things you can use for that. There are some over-the-counter remedies that people often use, like peppermint and ginger, and certainly those are all safe. But sometimes the nausea and vomiting progresses beyond what an over-the-counter medication can help with. And we have 4 options for treatment with nausea in pregnancy. Gynecology is the newest medication for nausea in pregnancy, and is specific for nausea in pregnancy. Because it's a little newer medication, it is sometimes a little more expensive if it's not covered by your insurance. The 3 other medications that have all been around for a much longer period of time and are also considered generally safe in pregnancy, a category C. And those are Reglan, Zofran, and Phenergan. Phenergan can be a little more sedating than either Zofran or Reglan, and so a lot of times, because you're so tired in that first trimester anyway, we do tend to save that one until severe nausea, or if you're unable to tolerate the other medications. But all those medications can be used safely in pregnancy. The other thing I want to touch on is cold symptoms in pregnancy. I don't know if most of you realize this, but pregnancy is actually considered an immunocompromised state. So when you are pregnant, every little cough, cold, sniffle, sneeze that goes around, more than likely you're going to catch it. And not only that, while your friends and family are better in a week from their cold symptoms, you will still be sick 3 weeks later. So most of us do need some type of cold medications in that 9-month stretch of time. Although we hope you don't become exposed and ill with some type of viral illness. If you do, certainly know that there are medications that are safe to take. A lot of the children's cold medicines are safe, but more specifically, symptoms for cough and cold that would be safe would be a Benadryl, which is category B, Tylenol, category B. Also, things like Sudafed are safe for women that do not have blood pressure issues. For coughs, Robitussin is safe. A lot of the seasonal allergy medications like Claritin, Allegra, those medications are safe. And again, if you don't have high blood pressure issues, you can use the Claritin Ds and Allegra Ds. One thing also we can use for other symptoms, Actifed, Dimetapp. Like I said, a lot of the over-the-counter children's medicines are safe. Just make sure you don't have anything with ibuprofen, because ibuprofen is not safe in pregnancy. Other issues that may come around include other GI, the opposite end of the GI tract. A lot of women have trouble with either diarrhea or constipation in pregnancy. And again, there are medicines that are safe to take for that. For constipation, which becomes pretty significant for a lot of women in the 3rd trimester, we recommend increasing the amount of fiber in your diet, bran cereals, bran muffins, apples, pears, things like that. But again, sometimes that's not quite enough. You can also add things like Metamucil, Fibercon to help. But again, if that's not enough, you can actually also take a Colace or a stool softener or Pericolase. Both are very safe in pregnancy. Milk magnesia and Citracel sometimes also will help with those symptoms. As far as the opposite problem with diarrhea, things like ammonium and kaopectate sometimes can be an option to help slow things down a bit. With constipation and diarrhea, sometimes things like hemorrhoids develop. This is very common, especially in the 3rd trimester and with multiparous patients who've had babies before. Things that are safe for this, things like Tux, Preparation H, Anusol, hot soaks. Sometimes those are not enough, and if so, let us know. There are some prescription medications we can prescribe for hemorrhoids, although insurance is not great about covering those, so they can be a little bit expensive. More GI medications as far as indigestion, heartburn, reflux, again, more common in the third trimesters. Things like Tums are extremely safe. Good calcium for the babies as well. Rolaids, again, very safe for baby and gives you some good calcium in addition. But sometimes that's not enough. So we do have things like Pepcid, Prilosec, Zantac. All of those are over the counter and safe for use in pregnancy. If those become where you've tried all those medications, you're using a pocket full of Tums a day and your Pepcid or Prilosec several times a day and it's not enough, please speak to us because there are some stronger prescription strength medicines we could give you potentially to help with the severe indigestion and reflux. Another thing that a lot of women suffer from in pregnancy are frequent yeast infections, and there are over-the-counter medications for that. Monostat, 1, 3s, and 7s, all of those are safe in pregnancy. Also, if that does not seem to be taking care of the problem, let us know because there are some prescription medications that we can prescribe as well. As far as headaches, sore back, things like that, we do want you to really try to avoid things like ibuprofen, Motrin, Aleve, Advil. Those are not safe in pregnancy, can affect the development of the baby's heart. But things like Tylenol, extra strength Tylenol, all of those are safe and can be used in pregnancy without fear. Antibiotics will kind of be on an individual basis since that will certainly be something that we will be prescribing for you. So we can talk about that if you would need it. But anyway, hopefully this brief little video will help answer some questions you have about what are safe options to take in pregnancy and things you need to talk to us more specifically about. Have a great day.